So today we are here with Dr. Phipps, practices out of Spokane, Washington. Dr. Phipps, tell us, how has Opal Seal improved the level of care you offer in your practice?
For the last almost year and a half now, we have been using Opal Seal on all patients when we start treatment, and any patient that we had started previously that we noticed some decalcification. And as far as I can tell, and this is not a true study yet, but this is my impression from several hundred patients, we're not seeing any decalcification. Now, the Opal Seal is applied to the teeth. We've been tracking it about every 3 to 6 months to see if it's still on the teeth. Occasionally, about 1 or 2 patients out of 10 will see some wear of the Opal Seal. And I don't know if that's how they're brushing their teeth or if that's a hygienist cleaning their teeth and scraping it off. We've done some work to educate the dentist as to what's going on and what it's used for. But the main change is we're not seeing the decalcification we were before.
That's wonderful. How are you finding that dentists in your area, your referring dentists, are reacting to the use of Opal Seal?
Well, they're very positive about it, particularly when they understand what we're doing and why we're doing it. Spokane is not a fluoridated community, and because of that, our patients are at higher risk than in a lot of other populations. So having something like Opal Seal on board has been huge at both protecting the patients and reassuring the dentist that we're not going to create a problem with our brackets and treatment.
Regarding your bonding success rate, have you seen any changes, and if so, tell us about them.
Well, the biggest change, Opal Seal is not only a bonding agent, but it's also like a primer and a bond enhancer. So we're not having to do multiple steps to increase the bond strength. Because of that, we seem to be seeing fewer bond failures, and that's been a plus.
What do your colleagues need to know about Opal Seal?
Well, they need to know if they're concerned about decalcification for their patients, like most of us are, and they'd like to prevent it to the highest extent possible. As far as I can tell, there is no better product on the market right now. Opal Seal is 38% filled, which is higher than any, which means it will resist abrasion and wear over time. And I'm expecting that for a majority of our patients, it'll last a good 18 to 24 months of treatment.
How would you say Opal Seal performs, including the results that you have seen, compared to other fluoride primers on the market?
Well, the most significant difference, actually there's two. One is that the Opal Seal holds up so much better. Any other product I've tried in the past, we were reapplying and reapplying and reapplying about every 3 months. We haven't had to do that with Opal Seal, except in very few cases. The other advantage is, being a bond enhancer, we're not having to use additional products to get an even higher bond strength, so we're not seeing the bracket failures we were before.
And finally, would you say it's simplified your bonding procedures?
Oh, definitely. What we do now to bond a bracket is we etch the tooth, and we use the Ultradent blue etch, which we can take right down to the gingival margin. We can apply the Opal Seal right down against the gingival margin. We're not having to use an additional primer or bond enhancer. We're just simply applying the Opal Seal, curing with a light, putting the paste on the bracket, curing the bracket on the tooth. It's fast, it's simple, and it's been very effective.
Thank you so much, Dr. Phipps.
Sure, my pleasure.